We're live now, so we have, Emily Ryan with us to sort of bring us up to date on the budget bill as it has been passed out and is, under consideration in the House. It's a kind of a way of, getting us what is in, what is not, what we need to have more information on, what we, don't necessarily, agree with. So I don't know which document you want to run us through. I'm wondering if, the web report,
Yes, that's probably the
a
best
good way of starting, because
place.
one of the things that's always a challenge is our base. And that helps us see, what has been done. And, I know that, at least from what I understand, is that the House Budget Committee worked very much within the governor's budget box. However, they have very large substantial bills and spending that are running separately from the budget, which we will take in and consider it all together as part of our priority setting for the budget. So I just want to say, for us, part of our discussion has been, if you adhere to the governor's budget box, there are certain things that have been a source of concern that we have talked about. One of which is the fact that there are certainly recognition of additional costs related to the state bureaucracy, but there's been no funding to increase the reimbursement to our community-based agencies that are providing services to so many Vermonters. And exactly what are the implications of not doing that? So will help us to see what's in, what did not get included, and how they might have approached it. So I'm gonna just let you run through here.
Sure, I would do that. For the record, Emily Byrne from the Joint Fiscal Office. So what you have in front of you is just the changes as compared to governor's recommended. So we didn't put.
I'm pulling of these forms.
Oh, sorry, this
The web
the
report,
report.
we're gonna go, we'll
There.
start base, which is really the base,
Okay.
okay, for now.
And right, so this is, as passed by House Appropriations, sort of subject to change potentially on the floor tomorrow, but.
This will certainly give us a framework.
Yep, so we'll start with the first one, B 104.1, the retired, state employees pension plus funding. So you'll recall, there was a sort of,
I do recall.
you do recall, the 13th mortgage payment, if you will, for the pension system. And the governor what he had recommended was to utilize carry forward to make this payment in FY 2025. What the House has done is they're reverting that carry forward and then appropriating the money back out to make it more transparent. So it was sort of just dealt with off the side, and the House has
But we're
brought it into
basically
the
using
budget.
a one-time reversion to
Yes.
fund a benefit payment that we're committed to making until 2038.
Yes,
And the reason that we had the ability to fund the plus payment was by making that $200 million payment toward the underfunding the amortized liability, and therefore the debt service savings were intended to support, because those would have had to have been paid if we had drawn down the liability and use those freed up debt service dollars to make this payment. So what is happening now is those base dollars are being used somewhere else in the governor's construct. And so this is going to make next year's budget more difficult.
As soon as we run out of what we have to do right now to carry forward, we think what to pay this with it.
Well, so
12 million from now to 38
it
or
moves to
change again?
15, and it caps out at 15.
Why does it change to 15?
Oh,
Some point
well,
in
Chris just told me yesterday.
Yeah,
I think it's next year or
next
the
year.
year after.
Yeah. So let's keep going here.
Yeah. So the next four, I think 1, 2, 3, 4 for the treasurer's office. This is, there's a position added in the treasurer's office, new internal audit director position, and it's funded, there's little pieces of funding coming out of all of the separate appropriations. So these are all the transactions that need to happen to get the interdepartmental
Can
transfer.
I ask just what the total is? Because that's pretty high. I mean,
What?
Yes.
134,000, 100,000, 830, and 11,000. That's over.
Yeah.
50,000 for an auditor.
So it's actually a double count. So in the first section in B 131, the 134,439 is an interdepartmental transfer.
Oh,
And so the 100,000, 11,000, and the 8,000 in the next three
That's how you get
sections
to it.
are
okay.
the funding streams, and then it all gets.
So it's 134 total,
And the,
not 260.
and the treasurer talked about the fact that these, you know, they're responsible for millions of dollars and they really don't have the horsepower for the internal fiscal controls. Part of it was security as well. So that was his testimony yesterday. Were you here when the treasurer spoke? Oh. But, all right, so we've clarified that that's not, you know, it's how you get to the 134.
Yep.
And the,
And there's
and that
no,
was that in the governor's recommended as well?
nope, that was added by the House
Okay,
per recommendation of the treasurer.
okay, at the request.
Yeah. And there's no general fund impact to that at all.
Right. Well, there could be a general fund impact because the more the cost of the treasurer, the less they might have to make available to come to the general fund.
Yes, for on-land property, but I think most of it is with the pension funds, because it's gonna help with auditing the pension funds, so it's allowable.
But it's
administrative
de
costs.
minimis, but there's still some.
Yeah.
Okay, let's keep going unless there are questions.
So the next one is B 200 in the Attorney General's office. So there is a position that is currently jointly funded with the Center for Crime Victim Services. I believe it's a victims advocate position in the Attorney General's office. This puts the full funding of the position in the Attorney General's office. And there's no reduction in Center for Crime Victim Services. The money is sort of left behind for Center for Crime Victim Services for other expenditures that
So
they
this
have.
is an addition of a general fund demand.
Yeah.
And it's ongoing, obviously, because
Yeah.
we're dealing with those.
Yeah.
All right, well, we'll keep on moving here.
Yep, the public safety state police piece, the governors recommend there was additional funding for 8 new contractual positions, mental health support specialists in the Department of Public Safety. The House decided to make that there were sort of 2 transactions happening. There was fully funding the 12 mental health crisis specialists in the state police. And then there were 8 additional that were added. The House fully funds the 12 and then only funds an additional 4 in the Department of Public Safety. And then this 468,000 is moved over to the Department of Mental Health to go to the
Did they do anything in those positions? There was a concern if the House Human Services wanted to move the positions. Yes. I believe that was. Instead of state police. Something they want.
Now, I think I know, because we had a brief conversation here, when that proposal came up, I said, why are we getting an MCO investment and getting Medicaid
Right.
for those positions? And the response that I got back was, well, because the appropriation was going to public safety and not through an agency of human services department, it didn't qualify. And I said, well, we should be able to figure out a way of getting it through one of the Department of Mental Health. These are the embedded workers, they work for the DAs, and they're kind of like crisis response, because you're not billing against an individual. And sometimes you might be going out and the situation doesn't involve maybe someone who's covered under Medicaid. So my goal, and if we can do it for 4, we're gonna do it for all of them. And structure it in such a way the money would flow through DMH to fund the positions
And then,
that are embedded in the state police.
There were 2 separate things going. Your argument, which I support. The commissioner was also concerned about activity in health human services, to move the positions so that they would be directly under the DMH.
if it.
Oh, they're in DAs.
They're in the
Well, I know, but they're.
They wouldn't-
It wasn't, it
No,
was be
no, they
so if it goes through
It
DMH,
would be-
then we get a match.
Yes.
Yeah.
The way that, the
Then you
governor,
can cut it.
the way the governor set it up was to have it all general fund and the appropriation go to public safety. And when that was proposed here, I said, we should see if we can get that as an MCO investment.
Yeah.
And the House did it for 4, and I'm like, I was thinking we should do it for all of them. And structure whatever the agreement, the appropriation may go to DMH, but then it would be, to go out to the DA to fund the positions to be embedded with the state police. And that would mean we get the Medicaid match. And I don't know what the issue was in House Human
Well,
Services,
Think of that there.
but the positions are in the DA, they aren't state positions.
No, they're not.
I understood that, but
One of the concerns that I had, a while ago, was that if they are positions in, for example, public safety and hired as public safety, their salaries are much higher and it will deplete gradually folks who are working at the DA, so it can't happen that way.
No, it wouldn't, and the reason you wanna have them as part of the DAs is that's where you've got your clinical support. You would also have ongoing, mental health
Right.
support, maybe someone actually needs to go into, a short-term crisis, bed. And, the nice thing about it is just,
It's a system.
because we will take credit for that right here, won't we, Senator Sears? Senator Ash, that whole approach toward embedding workers came out of this committee in the budget. And subsequently, Department of Public Safety hired Morning Fox, the former deputy commissioner of mental health, to head this off in public safety. And to me, that was very indicative of their support and appreciation for this approach. And we got really good testimony from public safety about the value. And when you can't fill all your state police vacancies, these are really actually a better response because the law enforcement isn't really the most appropriate. So I think we can claim success on it, but I want to claim all the federal match we can. And so I don't know how they moved the money. Did they move it to DMH?
I
Okay,
don't know.
All right.
The
They
mental health
grossed
crisis
it out.
specialist, this is from the DPS, it was there would be 2 designated agency positions in each state police
Right.
area.
and this would do it.
And this, well, if they cut them, that would,
They didn't put them though.
yeah, they took 4 positions.
Yeah, no, they funded for,
DMH. They just moved where they're coming, they're getting paid at.
yeah, how the money's flowing. I'm saying move the money for all of them in the same way.
Yeah, I'll look at the language when it comes.
They just moved the money from DPS to DMH for the DAs. Mental health special, crisis specialists.
Understood, but there was a concern about what was going on. I spoke with Senator Commissioner Morris.
Well, I'm sure the commissioner probably would like to have the money in her budget, but you can't, but you can't
It's
get
not
the
the
match.
issue.
All right, so, so I'm sure we can move the money in a way that we can get it
Issue
on,
was betting.
what?
It's the issue of, I believe the issue was betting.
Well, we can work that out. The main thing is getting them.
Human services, is my correct? My memory has not failed me.
Your
What?
memory has.
The issue for Chief Mr. Morris was not that they're attached to the designated agencies. They have to be. And your idea about getting Medicaid is great. Her concern was they didn't want them embedded. The House Human Services was going to recommend they not be embedded and be used for other purposes as well.
Believe that. Correct.
But did they do anything or did they just have a flight of thinking?
I know that they moved the money out of public safety to DMH, and then I think the language does keep it pretty general that they would be for mental health crisis specialists, but not necessarily specifically embedded in the bear.
All right, well, then.
That is the key problem.
However, so the question is, do the barracks have access to a crisis mental health worker on a daily basis? So that's the important piece. It doesn't
There would
matter.
be two in each barracks.
Yeah, so if the answer is yes, they do, then it doesn't matter if you say you got it or not, as long as they are, there was access.
I
We need to look at that.
We do need to look at it, and the advantage of having them embedded, then you've got consistency of the relationship. They understand, they've got good working relationships and, the more predictability as opposed to, gee, who's on duty to do it this time?
Exactly.
So I think,
Rebuild the relationship.
I think our concept of embedding, we like it, we're not changing it, and we will make sure we put in the language to, address.
So I'm glad that my memory hasn't failed me.
Well, I wasn't aware of that conversation.
Yeah.
Okay,
So very.
okay, so let's keep going here. To understand what I've.
Yeah.
Secretary of State,
Yep, so they are adding 2 positions in the Secretary of State, one IT specialist and one administrative coordinator, which I believe is gonna work on communications for the Secretary of State's office. It's funded with their special funds.
which means,
I can't remember which special fund.
okay, we used to get from the Secretary of State, some,
Those from the OPR fund?
Yeah.
I believe.
no, not OPR,
No,
no,
no.
corporations and so forth. We
Yeah.
used to get some money, it wasn't a direct app necessarily, or maybe it was to the general fund. But lately, there hasn't been anything,
Yeah.
they've used all the money, so there's nothing flowing left for the general fund.
Yeah.
Now they want more positions,
Yeah, and this is from their other special fund that was the one that used to direct that, and I can't remember off the top of my head,
Which
but I'll follow up.
I thought when they were in, but they wanted a couple more.
Yeah,
Mhm.
and they said that they're, because of the compacts, the funding as well. Maybe that's why one reason they don't.
No, we-
have money.
Well, we got,
General,
that's the OPR, and the OPR money can't be used for anything other than the regulation of the professions. Where the general fund was getting money was, the corporations and the other functions of the Secretary of State that would generate revenues and over and above what they needed, and they would be directly apt to the general fund. The more they're using the funds internally, the less there is to come to the general fund to be budgeted for other purposes.
Yeah.
Okay, cannabis control,
This is,
we're just annualizing what,
Yeah.
we approved.
was in the budget adjustment. So for B 301, I'm gonna skip those, cause that's the mixing bowl, and we'll talk about them as they hit the goal commitment. Appropriation, so in B 307, this was something that was in the budget adjustment, that the House version, and that didn't make it to the Commerce Committee, but this is the, VNA skilled
Oh, the
nursing,
LUPA.
the LUPA rates for the VNA. In public health, there's an additional 1.1 in opioid settlement funds for grants related to syringe programs. In the 13.3, the health department substance use programs, there's a few things moving around, so they removed the governor's grants to backfill the substance misuse prevention for the House Human Services Committee, but then they reallocate that same amount of money for grants to recovery residences and for a new grant
So
administrator.
they've used the opioid settlement funds for the recovery residences?
Yeah,
As opposed to,
the governor's for substance misuse prevention. That was a net zero change, and then
Substance, use the program 60.
how do we get some feedback? I know that this is on a different issue, but, we talk about, reporting back and outcomes and measurements. And, I've made the comment that we have an annual report on, it's a progress report on, while we're doing with, smoking. And the report doesn't have a shred of data that tells us how, are we making progress? Are we losing ground? And the reason I look at it is because we do terribly as a state and have for years on the rate of pregnant women who smoke. And so I always like to say, are we making any progress? What is happening here? What is the take up? It's all full of narrative. It's all full of whatever. And the whole thing is a progress report on how, whether we're gaining ground. And so how do we communicate back that we're getting a report that tells us nothing?
Well,
In terms of the progress we're making.
Well, I probably should, but one would wonder if, because that's embedded within the health department's budget in place, that we should remove, that effort from there and go out to a third party. There are, there's, programs, there's a CHAMPS program that deals with, through the United Way in Chittenden County that has been very successful in other, and maybe that's a place to look.
but that's.
I'm not, and I would not suggest not doing something.
But one of the things that we talk about is when we're putting money out, what are we getting in
Getting back.
return? What are the outcomes? And I'm saying, I got a report that basically says it's a progress report that doesn't have a shred of data in terms of how well we're doing and the progress being made.
And
And
this has been going on now for a half dozen years at least.
a
So
lot,
the youth risk behavior survey is probably really beneficial in that area, but you're looking at
well, then it's
something
more
different.
different. Well, I'm
But it
sure-
doesn't have pregnant women.
Right,
right.
Well, they used to have it, but I think they know I always look at it, so I think they've eliminated it, so I won't complain.
So when I have the commissioner in next time, I'll ask
Where the
him.
hell's it got?
Well, I
We
mean,
could put language in the bill about
The
that.
CHAMPS
Well,
program.
you're talking
within,
about the substance abuse?
the
United Way.
Deals specifically with pregnant women for other addictions.
I mean, that's pretty expensive to deal with
so I'm gonna keep going,
the
but
population.
I just, one of the things that,
Can't get any action.
this committee needs to always be looking at is when we're putting money out. What is the rate of, what is the rate, are we making progress? And what are we seeing? And what are those trends? And so I just bring it up as, when we're getting reports and they go to the various policy committees, are we looking at how well our interventions are performing? And so I'm realize when we're talking substance misuse, but it triggered the thought in terms of how do we evaluate these programs relative to outcomes and what are the right metrics?
Well, if
And
we aren't doing well, after a while, you might wanna leave it out.
well, and I don't want to get back to, the auditor did a report on what we were doing in terms of, what we have in statute for, desired outcomes. And, saying there's no correlation between what's being reported and what we're doing. And it's like, how do we, if we're gonna have a performance officer, then we ought to be able to have that kind of examination in part of the report, or why do it, other than just that, have you seen that report that comes out from the chief performance officer?
It's crappy.
All right, so it has no utility, and
It is.
Thinking this poor person's working like a dog, and they happen to tune into Appropriations. Here's that fun.
We're, according to the CDC's 2021 report, we're sixth for pregnant women's smoking,
6 in the nation.
Six worths?
the sixth worst. Yeah, there's only 5 other states that have worse rates.
What are the ones above it?
Missouri, Kentucky, Maine, Arkansas, no, we're worse than Alabama, we're worse than Mississippi, we're worse than
We allow it.
Louisiana, we're worse than Georgia, we're worse than South.
Do you see why we, are troubled by that? And kids are coming home into homes where they secondhand smoke. We know it's low birth rate and we talk about the importance of prevention. And, it seems like maybe we should try something different.
We'll put more money into prevention.
We're half of.
Ban
West Virginia.
flavors and menthol, that would be the first one.
Yeah, you do.
West Virginia.
But,
Menthol, well, you have to ban the things that are attractive.
well, that would suggest that what we're doing with teens isn't very effective either. Because but usually people of childbearing age are not too far out of being a teen.
It's really difficult to compete with an industry that invests millions and millions.
That argument doesn't weigh, how come we're 6 out of, how come Mississippi's ahead of us?
That's for.
They sell menthol too.
They can't afford it.
Oh, is that it?
Yeah,
I don't know.
That's it.
I would say the bicycle we're riding, we
I'd be
better
a
get
little
off.
embarrassed if
on.
Mississippi and Alabama are ahead of us.
Prevention.
We're headed in the wrong direction.
My only point is, some other states may have interventions that seem to be more effective than the ones we've been pursuing for the last 2 decades. But, let's keep going. Anyway, it triggered a bad thought on my part.
We should talk to Rhode Island, they had 54% reduction,
My 50
Oh, all right.
that's not that far away.
That is great.
Connecticut, 51%.
So, hey.
50,000.
So committee, I'm gonna keep going
Yeah.
on mental health.
Good thing.
Yeah, well, I was gonna point out, there's one more in the, substance use, there's 795,000 special funds, is opiate settlement fund, so there is some movement in where the opiate settlement funds are going, and we have a spreadsheet on that, we can bring that. To the committee, so you can kind of see.
Wasn't there a lot of controversy about the recommendation, because the advisory committee on,
Oh, the advisory committee wanted to use the opioid settlement funds for the opioid prevention sites.
Prevention.
Yeah.
Yeah, that.
And at that point, the commissioner decided no and didn't put it in. Now, I think we're gonna be taking testimony from him. I think he has decided that it would probably be an okay use.
Yeah,
Speak for him, Commissioner.
he gave an interview where
He said,
he changed his personal opinion, but made it clear that his boss was still,
I was talking a couple of years ago with a legislator in Maine who was a physician. And she said medical evidence is clear in terms of the protection and whatever. But it's the political and a lot of the law enforcement community have strong feelings of.
but you know, and Jake knows this as well as anybody. We've taken these series of steps, one of which was testing strips. Or even allowing people to bring in their substance to be tested. And that was opposed as crazy. Now that's standard practice. The governor supports that. But it's like we keep facing a drawn line every time we try to evolve that policy.
and a lot of it is really based on perception, what people think is going on with people who are addicted. And so they think about, we heard testimony this morning, that they're thinking about people under the bridge with trash all around there, that's where they're injecting, and that's that. They don't have the vision of a clean clinic, the support services available, or the testing available. It takes time to appreciate.
Much testing is needed now.
No,
Where they
Well,
are.
Yeah, it's all
100%.
fentanyl.
Yeah, that's been so.
I'd like to know
But you
where
might
they're
wanna test
all
the
getting
virus.
their money from to buy
Yeah,
those
exactly.
syringes full of drugs.
Whatever we can test.
You know,
So committee, I'm gonna keep going, if we can get through a few more of these sections, without triggering great thoughts, but I guess. I think one of the things, if you're on one of the other committees, is really start looking at what are we being given for information, how helpful as it is. Sometimes we overload it specifically and very deliberately, so nobody will plow through it. Sometimes we get a report and it is
Anemic.
anemic, yeah, so,
We're,
long on
314.
rhetoric and short on data, I would say.
314.
So we're down to, 314, mental health.
So this is the, what we just spoke about in Department of Public Safety. This is the global comment. This is the 4 positions. If it's run through the mixing bowl and then it's grossed out to 1.1 million. For crisis management with the DAs and SSAs. The next section, 318. This is the restoration of the child care financial assistance funds for $9 million that was removed from the governor's recommended budget. The House did adopt the governor's recommended $10 million reduction in CCFAP in FY 2024. So that's in the C section of the big bill. So given that we're most of the way through the year, they haven't utilized those funds. Those were reverted back to the general fund. But or not reverted, the appropriation was reduced in FY 2024, which helps bring this into balance. But then there's this $9 million they restored in FY 2025.
When that is coming up.
but it's from a territory.
No, what really, what we're experiencing is, you gotta build the capacity,
Yeah.
you've got to, get people trained, and you've got to expand the eligibility. So during this ramp up period, money is being freed. And that's what we're experiencing here, but it's the fact that they've taken it from the base. And, what we need to be confident in is when we were setting the revenues that we needed to generate from the payroll tax, it was assuming a base of general fund, in place.
Mhm.
And so what is the interplay between, those two revenue streams relative to, when you get to the, finalize that rollout of the expanded eligibility, the expanded, increases in reimbursement, particularly for young children and so
This,
forth.
this is all on the subsidy side, though.
Yeah.
This is not about the development system
No.
to the work.
But we know that it takes time to get centers to expand or to get created, to hire the staff, and so there's lag time as it would relate to getting the adequacy of the childcare system that is needed to meet the demand and the affordability piece of it as well. So we did 2 things.
Financial assistance, is that for buildings or is that?
No, that's for
That's
family,
for
that's to help
families.
families underwrite the
Healthcare
cost of care.
financial assistance for families. And there's the next step up is April 1st, and then the one after that is October 1st.
So the bigger question is,
Meeting with them.
is this
Spending the afternoon with Friday.
a one-time or a time limited kind of availability of funding relative to what that mature program will cost.
And we won't really know until.
But nothing
We should
wrong with
get them all.
I think the
Yeah,
only
I did,
thing
look at some too.
I would just point out in D 318, it is a significant increase between FY 24 and the governor's recommend, and that's both the general fund $50 million that was put in last year as part of Act 76, and then the
special fund.
the special fund is going up due to the payroll tax that will go into effect July, and then this is spending that new special fund. D
Should
3
give them a. Should take care of them.
Well, it was designed to do 2 things. We increased the eligibility for families up to 575% poverty. So we expanded the number of working families that could get the benefit. And we also increased the benefit payments so that people could afford to work in childcare.
Yeah.
So there were 2 pieces relative to the amount of subsidy we're providing to families and making it available to more families. So, all right, we'll keep
I can
going.
check for the measurement on the alcohol.
Yeah, we will.
From the.
Childcare,
Yeah, I can see how many, yeah.
Childcare, then we went out doing literacy bills like we did yesterday. For 3rd graders, maybe.
Or Dolly money.
Oh, no,
don't bring that up.
no, that would be too.
You know, it does, because years ago, remember Success by 6? The whole concept was kids would be prepared to come to school and would succeed in school. And, a great initiative, a lot of money went in, and the question is, what do we have, half our kids are not reading at,
Oh, third grade, half of
Third
them
grade level.
being.
I'm reading at the, established level. Mhm.
50% below 50% in third grade.
Yeah,
Well,
so,
that's embarrassing for the amount of money we spend per child. And have children testing at that level. If I was on the school board, I'd close the
I think,
school and
I think some of it,
start right over.
well, I think some of it is, people that come in with new, teaching methods. And what was it, the whole word, you know, that whole approach, and I mean, most of us grew up with sound it out, phonics, and now all of a sudden, sound it out and phonics is back.
Oh, you guessed at it now.
Yeah,
But
no,
remember something else, there's been an intervening time of huge technology, so kids aren't. They're
reading,
not reading books, they're looking at pictures.
Yeah.
And they don't have parents either the parents are distracted with 2 jobs and 3 jobs and a lot of stuff going on.
but, you know, nevertheless,
She never talks.
we should look at,
About what?
we should be looking at other states and how we rank, because it's not the amount of spending for per pupil. Our staffing ratio is like 4 to 1, which is about the lowest in the country. And so it raises the question, and I guess Mississippi has come up with a very good model, you know, I guess, teaching curriculum to teach kids how to read. So, I guess we probably can maybe take some lessons, some transferability from other states. I don't know, we'll keep going. At least hopefully we can get through this mostly today. I mean, through the agency, that's all I really wanna do. So we've got aging and we're on to
We're taking money from
3:30.
meals on the way.
Okay,
Yep, so they're moving, they were moving the $1 million grant that was in the base to the Global Commitment Fund and then bringing it back through as a matched dollar.
then we have a approval that from CMS that in fact this is an
I'm not worried.
eligible
No,
expenditure.
I don't, last meeting, we didn't have the approval, and this tells them to. But I will know
I
that,
think
on-
there were,
I'll know that on Friday.
Well, we had talked about that and I think it was in the, we did not put it in the budget adjustment, but there was acknowledgement that they would be trying to see if that would be an acceptable investment. And last I knew, they were trying to do more to get more on the room and board coverage as well as part of the correctional services.
there's 2 things going on in correctional services. There's an additional 700,000 general fund to fund 2 grants, or not grants, excuse me, contracts. That are listed in the notes, and then there is this is similar to what happened in the budget
Oh,
adjustment.
it's just
sort of
exchanging ARPA for general fund.
And there's,
This
No.
PS personal services.
yes, yep, so it's being added to personal services. Yes, there's an ARPA swap happening in corrections again this year. The House identified $5 million in the weatherization appropriation from ARPA funds. The department has plenty of capacity and didn't think that they were gonna be able to spend those dollars. So that $5 million is a bit for ARPA it's reverted in the language and then reappropriated to corrections to free up the general fund, which then just sort of drops to the bottom line.
But it's one-time money.
It's one time, correct?
Did we do this in the BA?
No, we did some conversions, but this is
Not too
a
correct.
different one. And we had some rinky dink ones, there were like 4 or 5 that we had in order to.
Yeah, there was a similar, it was several different line items, but it was a full $5 million that was
Right.
reverted and then appropriated to corrections and then the
To
general.
me, one of the
funds.
questions that we have to ask here, I don't know where they put their $5 million, but if there's anything that is a strategy for reduction, and that's thermal thingy. Yeah, well, you're right, it's transportation and then it's thermal in terms of carbon emissions.
Oh,
And so by not somehow setting it aside or continuing to have it available for weatherization, even though it's not right now. If we're looking at that longer term agenda, for people to get their homes weatherized and reduce their heating costs.
We had Gus in the other day in ag.
Yeah.
And he said that they were running out of money to do on-farm labor housing upgrades. They were, Burlington is it Burlington Land Trust or Chittenden Land Trust?
Chitlin.
He said,
Champlain.
he said there was
Housing.
less money. He didn't say that it was all gone, but there was less money.
Yeah, they're
So that's a question in terms of how they use the 5 million and the extent to which we want to look at how it is.
Right.
Okay.
Thanks.
funny, they didn't spend.
All right, labor, nothing changed there. And then 501 education services.
Yeah, so there, 501, so the governor had added $100,000 for a CTE education programs
Which is
coordinator.
what we just got in our bill that we pulled out. Until the House pulled that out.
Yep.
Even though the governor recommended it.
Yep.
And we have it on our list as a request. Okay.
Is that Senate bill? Yeah. that was-
Yes, it was. Yeah, we had a Senate bill on CTE. And we've moved rulemaking for CTE from the board to the secretary. All right, adult education and literacy.
Yep, so this, and this one I think we have a spreadsheet on or a little bit more detail. There's a couple things happening both in the flexible pathways piece also involving adult education. So there's education funds and general funds going to adult education.
Is this to fill the gap?
Yes.
Even though they said the other changes would take care of it? Remember the assessment changes and stuff that
Well, the assessment changes with the changing.
well, there was some discussion.
What's the breakdown on that between adult education and literacy? Cause it doesn't seem to show, it just says 4.6,
Well, those are our adult basic ed programs like Northeast Kingdom Learning Services that exist throughout the state.
That isn't two programs.
No, it's one.
One.
Uh-huh. Okay, so I guess that's something we need to look at because we spent a lot of time. The question was whether the changes would fully fund it and the house moved $1 million?
Yeah, ed funds related to the community schools bill, but they've been calling it the OC's bill.
So,
Each 874.
so this is not everywhere where, adult basic education shows up.
What's not?
Where?
They have a $6 million budget to run that. So, all I see is 4.6 here. And a piece of it comes out of the ed fund.
Oh, yeah,
So
schools,
where is the ed fund piece?
in the ed fund budget.
Because they
It's in the-
changed that too.
I don't wanna, I'll follow up on that.
Yeah,
I'm pretty sure it's in the district's budgets, depending on how, if this.
I think it would be, because then they,
If the student
but-
is
but
doing it a different.
we can't, this doesn't tell the whole story. There's a bigger picture.
There's 6 overall.
well, it would be because schools, sometimes students under pathways might be.
And
taking courses.
that report called for something like 40% of the total of their funding to be coming from the ed fund. So
Well, this is,
It's over on the next.
and
This is
Representative
all-
Mahalik has got, he's got all the details because he led the charge on this.
Yeah.
I gotta sit down with him.
all right, but is this your section?
Well, I've been doing it for,
All right, Okay, perfect, all right. I guess Senator Baruch will object if you try to figure out the
I
details.
carried it in the last two
You'll be carrying the
budget
water.
negotiations.
Just walk it.
You can do it if you want, I'm happy.
I am completely confident in your ability.
Boy, that's a big mistake.
But I thought we were also looking at,
Break that off.
how some of the programs,
So give them a
managed the money and others did not.
Well, that was the problem. You had at least two of the organizations that totally managed the money, and the biggest in one didn't, so.
Well, I realize this is painful, but we're gonna keep going, to finish up with, general education, so. Nutrition, I gather that's just the cost of the hot lunch program.
Yep.
Uh,
There was a reduction in the BAA also, based on what they think.
So it's now $24 million program.
And the VA was also 2.5 million,
I can't remember off the top.
somewhere around there, not that.
Um,
This next one in B 514.1, this is related to the position that's added in the treasurer's office, the internal auditor. This is the little piece
that they're paying for that.
that the state teachers retirement funds will help with. Um, you do higher ed really, but also.
Yeah, I guess we could. Do we want to keep the dollars if we keep that open?
$1,
Yeah, well, that's
Morgan
why.
Horse Farm.
Yeah.
Yeah, for sure.
We could cut it by
I think we ought to raise that by 100%.
You want to get a $2 bill?
Yeah.
We have wraparound services for the.
That's it.
At least change
So
his on.
We can do the-
Where's
He's
the,
stealing other diabetes.
where's the state college stuff?
I don't know.
The additional 5 million for the state colleges is in the one times. The bridge.
The base funding that they asked for, another 4.8, and then they asked,
Or you.
This is just the
but it
change.
says higher ed, so.
Oh, so the only change in the higher ed section is the
Is the
$1 for the more.
So what the
How's
House
that
did,
put it in?
in the fourth year of our promise to,
Well, that's a one-time and it goes on our one-time list.
What, the $1?
No, not the $1. We're talking about the bridge funding for the transportation.
We'll get to that one. That's later. That's in the B 1100.
did they, in the their one-time list in the back, they did move them to the 10 million?
Yes.
Okay, that was my question.
The one-time list was in the back of the bill.
But we don't show the appropriation for, even though.
We do, this
It's
is,
in 1100.
yeah, this
Yeah, the one-
is just the changes. There's a web report, there's another web report that's got
Okay,
everything.
that's what
But
I'm
we figured
thinking.
we should just give you the changes
All
right now.
Because obviously we do an appropriation directly to the
Yes,
state university and to the University of Vermont, so.
when the bill is done in the house, we'll print a big
Okay.
copy so you can use it for Monday.
So I think that gets us down to natural resources. And, that I do totals, the fish hatchery is here.
To my great relief.
We're not having any further discussion on that, we're going
How
to.
much is that fish hatchery in the window?
And is it
One
walleye?
of the wagons.
No,
No, it's trout.
it's trout.
What about the walleye? What will
So
they do?
That's another place.
I am
Not
going
fish
to,
trap.
committee, I'm going to call it a day and we'll end at Commerce and Community Development. And we'll just keep going, because it, shouldn't take us too long. And what do we have scheduled for tomorrow? Just more of this, okay.
Just,
You put more.